Hey, it's Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about black triangles. And I know this sounds really ominous, but a black triangle, as you can see here, is this little triangle right here. There's a couple. There's a big one, there's some little ones, okay? So it is something that happens as you age. There's nothing you can really do to prevent this besides just having the best hygiene that you can, going to your dental appointments, but it's just gonna happen. Some people are also more predisposed to it. It depends on many different things. Like if you had a lot of crowding and then you went to get maybe braces or aligners later in life, and as you straighten the teeth, that sometimes the gums they weren't maybe the right size before when you were growing. So as you straighten the teeth, they kind of shrink down a little bit, just trying to adapt to their new space. So maybe you didn't notice it when you had crowded teeth, but because you chose to have braces or aligners later in life, it now becomes noticeable. So not much you can do there about that either. They're actually healthy. So I think there's a major misconception that they're bad, and they're not at all. They're very healthy because your tongue and everything can clean the area very well. So you don't get food trapped in there. Now, there is one way to reduce the way they look, and it's called IPR, or interproximal reduction, which is where you do a little bit of sawing in between each of the teeth, and that allows you with braces or aligner to approximate or bring the teeth together. It's not unlike, you can also fill them up or cosmetically minimize them by doing a veneer or a laminate or a composite or a buildup, which is basically tooth fillings. That could be either porcelain or plastic. That would help to fill it up. But again, anytime you do that and you minimize them, you actually increase your risk for cavities, gum disease, and other things because it makes it more difficult to clean it now. It's because the teeth are touching more and the contact is tighter and the tongue and the lips can't self-clean them. So you have to keep that in mind. So I think people think that their teeth are supposed to be like fence posts, like vertical chiclets. They're not at all. They're supposed to look like this actually. So it's actually unnatural for you to try to reduce or eliminate all your black triangles. So I'm just, explaining the why behind it because I think a lot of times dentists get really frustrated when patients complain about them, especially after ortho treatment. It's really only healthy to do up to 0.5 millimeters. It's half of 1 millimeter. That's half of the tip of a pencil. Lead, super tiny. That's all the interproximal reduction you can do between each tooth. So once you do that, because then you're gonna get closer to the nerves up here, right? So you can maybe make it a tiny bit smaller, but you're still gonna have it in this circumstance. So if you wanna do a veneer, that's fine, but they're very expensive. And if you do like a composite filling, they don't last very long and you have a high tendency of getting decay. So veneer is probably better, but I mean, you're talking probably about $1,000 a tooth. So down here would be about $6,000 to do that. Personally, I don't think it's really worth it. People probably not gonna notice. The only ones they might notice might be the top ones. And then maybe that makes sense if you have a high smile line. But I just wanted to really explain that you don't have to freak out about a black triangle. Everyone's got them. If you don't have them, you probably have fake teeth. That's pretty much it. So hopefully that answered your questions. Thank you.